DSW 2310, Dual Diagnosis, Treatment and Assessment, Chapter 11, Obsessive Compulsive Disorders. Trauma. We all experience stress. Some of us have or will experience trauma. 39 to 75% of the general population have dealt with at least one trauma. Trauma can include a person's reactions to the life event. Trauma includes assault, rape, abuse, accidents, criminal victimization, catastrophes, bullying, natural disasters, etc. Witnessing events or hearing about traumatic events can be traumatic. Trauma can be physical and/or psychological. Persons with developmental disabilities experience more adverse life events than the general population. OCD is a psychiatric condition. Experience obsessional thoughts. Understand that these thoughts are irrational, but can't stop them. Obsessions involve dirt, contamination, diseases, real or imagined trauma, or other frightening or unpleasant themes. Thoughts are usually unacceptable and provoke anxiety and embarrassment. Thoughts occur all the time, can't be ignored, leading to an overwhelming anxiety. Thoughts turn into compulsive behaviors, repeated activities or rituals. Behavior is associated with relieving extreme anxiety, not done out of pleasure. Behavior interferes with daily functioning. Symptoms: obsessions, recurrent and persistent thoughts, impulses, or images being experienced, causes marked anxiety or distress. Person attempts to ignore or suppress thoughts, impulses, or images. Compulsions, repetitive behaviors or mental acts person feels driven to perform to an obsession according to rigid rules. Behaviors or mental acts are aimed at reducing anxiety or preventing some dreaded event or situation. Obsessions or compulsions cause marked distress, are time-consuming, more than 1 hour per day, significantly interfere with daily routine, occupation, school functioning, and/or usual social activities or relationships. See handout, Compulsive Behavior Checklist, a data collection tool designed for people with developmental disabilities, completed by someone who knows the individual well. Compulsive Behavior Checklist. Compulsions. Ordering compulsions. Arranges patterns. Insist on doing tasks in same order at same time, etc. Completeness, incompleteness compulsions. Opening, closing doors. Putting clothes on and off, etc. Cleaning, tidiness compulsions. Specific sequence of hygiene. Clean self excessively. Picking lint, thread, hiding objects, hoarding, etc. Checking, touching compulsions. Touches, taps, repeat sequences, stepping patterns, etc. Deviant grooming compulsions. Picking, gouging, checking self in mirror repetitively. Inappropriate cutting hair on parts of body, etc. Key diagnostic indicators in people who are nonverbal. Aggression when compulsions interrupted. Tense facial expressions. Neediness, clingy behavior. Tantrums or agitated outburst. Hyperactivity. Differentiating between compulsions and rituals. Compulsions, symptoms of anxiety seen before behavior begins. Behavior temporarily relieves affects of anxiety. Person may try to resist behavior. Behavior is not related to escape. Presence of obsessions may not be detected with nonverbal persons. Rituals. Anxiety usually not present before behavior begins. Behavior is calming for person. Willingly engages in behavior. Behavior does not distress person. Behavior used to escape. Absence of obsessions may not be detected with nonverbal persons. Treatment for OCD. Psychotherapy. Behavior therapy. Institutionalization. Limited repertoire of responses. boredom and lack of empowerment factors which predispose people with developmental disabilities to develop OCD, drug treatments, antidepressants, anti-anxiety.